This is a group presentation on improving internal and digital communications at IU Health North. The group members are Gabriel Crowe, Jordan Elliot, myself, Zach Harrison, and John Perez. And this is for the ISOM 249 Foundations of Business Communications at Ball State University.
For our agenda, what we're going to talk about is a quick introduction of IU Health and why it's important. We're going to talk about the methodology and how we found our information for this project. Next, we're going to go into a discussion and analysis of what we found from our research. And we're going to finish it off with talking about 2 recommendations of how we can improve digital communication at IU Health.
I started off with the introduction. The purpose of this report is to raise awareness of the communication issues within IU Health North and try to provide them with some substantial solutions and that will ultimately save money, time, and people's lives in the long run. All right, IU Health North Medical Center, that's a branch of Indiana University Health. It's located just north of Indianapolis in Carmel, Indiana, on Meridian Street, and it opened in 2005. This specific branch has provided care for both adults and children through physician offices and admitted stays. The building itself stands at 6 stories tall, and it contains different options for care, including labor, delivery, imaging, surgical suites, and just everything else the hospitals cover. The building is 440,000 square feet, and that doesn't include the 5-story medical office building that's attached to it through a different glass atrium. Their mission statement is to improve the health of patients and community members through innovation and excellence in clinical care, education, research, and service. With IU Health North being affiliated with the rest of Indiana University Health, they're equipped with all the top tier equipment and medical personnel that the rest of IU Health has to offer, which gives them a pretty good advantage against the rest of the networks within central Indiana to provide the best care possible. The market for this facility is cities such as Carmel, Westfield, and Fishers, and other rural communities around that area that people are willing to travel, is Madison County, Delaware County, and other smaller counties like that. One of their clients would be one of their clients for Indiana University North Medical Center would be Main Event Merchandise Group, which is who IU Health buys all their uniforms through, and that's a branch of Shmushke Enterprises. Some customers from IU Health are children and adults, the ones who are seeking special care for rehabilitation services, emergency services, oncology, and just all the other forms of primary care. Different employees throughout this facility would be, obviously nurses, doctors, physicians, assistants, office staff, secretaries, maintenance personnel, custodians, and like food service or dining employees. This hospital has 1 CEO and 3 vice presidents. The CEO is Dennis Murphy, and he was recently honored with a American Lung Association Legacy Award. The 3 executives or VPs are Jason Gilbert, David Ingram, and Aaron Lewis, and they are the chief nurse executive, the chief medical officer, and the chief administration officer of this building. IU Health North Medical Center it's a very important organization, and they have to operate effectively and efficiently so they can provide their award-winning healthcare for patients. And if they do so effectively, then they can provide a template for other hospitals nationwide on how to operate. The purpose of the audit that we did is to let IU Health North, understand their communication issues from the top level all the way down to the bottom, and we focused on internal and digital communication. That we did that so that way they can understand that something has to be done before something drastic might end up happening for them. The rest of this report, like I said, it'll contain methods that we use to get the information, discussion, analysis, like we talked about in the agenda, and we'll give them a few recommendations. That way they can start working on their changes from there. And for the methods, I'll pass this on to John.
For methodology, our primary sources were Google Scholar and EBSCOhost to find all the research that we did. And for the main information about the hospital, we used IU Health website. And some of the important information we got from that website was how they operate, how much people they staff, and also their financial statements so we see how they're performing. For our secondary source, we use just a regular Google search engine. And the reason we use that is because as opposed to Google Scholar or EBSCO, it's much wider because it's not limited to only research articles. So when we wanted to find more niche topics or a broader array of information, we just use the regular Google search engine. And some of the key phrases that we used when we were doing our research were what are the biggest communication issues that hospitals face? And we chose that to get an overall understanding of the main issues that most hospitals face. And we also, once we did that and we got more information, we narrowed down our topics such as outdated technology in hospitals and how language barriers affect hospitals. Moving on to our discussion and analysis, I'll pass it on to my partner, Jordan.
Thank you. IU Health North operates in a high-stakes environment where communication is vital, and not just for operations, but for patient safety and satisfaction. With a diverse group of stakeholders, including doctors, nurses, and patients, clear communication can be the difference between life and death. Research shows that nearly half of all malpractice claims involve communication failures, with language barriers contributing to over half of those cases. Poor communication leads to delayed care, medical errors, and even patient deaths, costing the U.S. healthcare system billions each year. Let me start with what IU Health North does well. The medical center uses structured tools like SBAR, standing for Situation, Background, Assessment, and Recommendation, and Electronic Health Records, or EHRs, to aid in proper communication. SBAR ensures accurate handoffs between care transitions, while EHRs support detailed asynchronous communication across all departments. These methods build trust and align with the best practices in functional communication. However, there are two major issues, with the first being language barriers. Limited English proficiency continues to disrupt patient-provider communication, especially when untrained interpreters are used. Family members are also relied on, but this can often lead to the spread of incorrect information. The second issue we discovered was the use of outdated technology. It's estimated that hospitals using outdated technology are currently losing $8.3 billion per year. The current systems lack efficient operability or rely on tools that slow down workflow and increase the risk of errors. To strengthen these issues, we have developed some solutions. To strengthen communication, we believe that they should keep using SBAR and EHR systems, but stop relying on untrained interpreters and outdated software. While IU Health North has strong foundations, improving language access and upgrading technology are essential next steps. Doing that will reduce errors, boost staff efficiency, and most importantly, save lives. We will now present two specific recommendations we developed to improve these problems with my partner, Gabriel.
So recommendation number one, what we focused on was to incorporate the foreign language training with translation tools. Some of these may be like Babbel, but you just invest money into your people so that they can learn a skill that will last them a lifetime and help them save lives. We do that because language barriers cause over 53% of all miscommunication issues. At a hospital, this is extremely important. If we are not on the same page with something, lives can be lost. So the most common language, excluding English, spoken in Indiana is Spanish. If we are able to focus in on helping individuals learn Spanish, then we will be able to help all of our clients, customers, and individuals that are being seen at these hospitals. So incorporating foreign language training results in less reliance and interpreters using interpreters as intermediaries allowing us to be helped in that field. And interpreters cause added additional labor costs, approximately $54,000 a year. This will increase credibility and complete competence in caring. And so by doing this, Spanish for entities is a Spanish school in Indianapolis. It's a 13-minute commute. This is a way that we could help our people that work at IU North and help them be able to learn Spanish. It has a Spanish course meant for health professionals, so that is perfect. And it's accredited by the Real Academia Espanola and the CEFR. So this does flexible and in-company lessons, so they can partner with us and we can be on the same page. And it allows for minimal disruptions in the hospital. Training takes about 150 hours or 50 hours a week. So once you're done with that, you're done, and you're able to understand Spanish in a way where you can communicate with your clients and individuals that you're taking care of. So it's $3,393 per employee to become proficient in Spanish. That is extremely important in our eyes. And like I said, Google Translate and Medibabble are online translation tools, and Medibabble is specific to healthcare, allowing us to take proper care of everybody that we need to. It's effective for complex medical conversations, which is perfect, and 92% satisfaction rates among providers and patients allows us to feel like we are not spending our money on something that does not matter. This is something that is extremely important, and when lives are at stake, we need to take proper care and we need to take proper precautions. And using something like Medibabble and Google Translate is extremely important. It's easy to use. You just type in or speak what needs to be translated, and it allows you to translate that. And it's zero cost to download these. So it's a low cost thing that could save lives and extremely important. And then I'm going to pass this on to John for recommendation number 2.
So our second recommendation is upgrading the outdated technology, and we recommend using CCNC or Clinical Communication and Collaboration software. And the reason we want to do that is, as stated previously, outdated technology wastes about 45 minutes a day for work, and it costs about $8.3 billion a year in additional costs. And that's all because of the inefficiencies and the delays in transferring information. And what CCNC platforms are is basically applications that can be downloaded on mobile devices or laptops. And they're text-based, and they could also use video calls or audio calls. And another thing that's efficient with them is they could connect to electronic health records and hospital staff. And that makes it a lot more efficient because they could transfer information between colleagues a lot faster using the text messages. And it's also a lot easier to find information since it's instantly accessible. And hospital staff schedules is important because instead of running around trying to see what nurses are available, what surgeons are available, what physicians are available, you already have access to the schedule. So you can see exactly who's on shift, and you could contact them right there and call them or send a message. And another big thing is all this is HIPAA compliant, so there's no worries about privacy leaks or anything. And instant access to health records also improves communication between staff because we don't have to send emails or faxes. We just attach those attachments to the emails and send them. So CCNC platforms, they've already been proven to be effective, as 71% of health professionals already state that it makes communication a lot easier. And another benefit is that it relieves our staff of administrative tasks. Instead of running to printers, running around looking for people, they could just use the CCNC platforms and get back to our patients right away. And that's important because they can spend more time with patients, understand their problems more, and also improves the patient to professional communication. Another big benefit is it improves accuracy in patient handoffs by 51%, which is a significant number. And the software that we recommend is Connect Team, as they're one of the leading CCNC providers. And it's pretty easy to make an account. You just go on their website and you spend a few minutes making an account for the company. And from there, you can send out emails and messages to the staff in the hospital so they can download and make their own accounts. And for the communication platform that they offer, it's only $99 a month for up to 30 employees. And each additional employee after that is $3 per month. So to wrap this up, I'm going to pass it on to the conclusion with my partner, Gabriel.
Okay, so we hit on a lot of important things. We wanted to take control of IU Health and their communication issues because this is an important field and this is going to save lives. So we believe that effective communication is crucial for patient safety and staff efficiency at IU Health North. Despite the strong protocols like they have with the SBAR and the EHR systems, and major gaps still remain. These language barriers between providers and patients are still there, and outdated communication technology like fax machines and pagers are just not working with the efficiency that we need to keep these hospitals running at tip-top shape, and they do need to be tip-top shape because this is extremely important. So poor communication contributes to 1,700 plus patient deaths over the years and 1.7 billion in malpractice settlement costs. 49% of malpractice claims linked to communication failures. So this is something that we really do need to fix, and we are taking initiative right now to do so.
And this final slide is the references that we use for all the information. Thank you, and this concludes our presentation.